The Real Anthony Fauci. The video was produced based on the book The Real Anthony Fauci and other internet sources. Introduction. Robert F. Kennedy Jr. wrote this story to shed light on the events that unfolded in 2020, during which governmental health regulators, media, and social media platforms seemed to act in unison, suppressing free speech and personal freedoms. The story delves into how these institutions appeared to promote fear and obedience, leading to mass public health experiments involving novel technologies. According to the author, Dr. Anthony Fauci stood at the center of this situation, steering the United States response to COVID-19. Robert F. Kennedy Jr. recounts his personal journey to understand how institutions meant to protect public health and democracy seemingly turned against citizens. He reflects on his family's long-standing involvement with America's public health bureaucracy and friendships with regulators like Anthony Fauci. The author discusses the concept of regulatory capture, where regulators become loyal to the industries they are supposed to oversee. He expresses astonishment at the financial entanglements between the pharmaceutical industry and government health agencies, citing examples such as the CDC owning vaccine patents and the FDA receiving a significant portion of its budget from the pharmaceutical industry. The story traces Anthony Fauci's career, from his early days as a public health researcher to his role in shaping the response to the COVID-19 pandemic. Robert F. Kennedy Jr. explores the militarization and monetization of medicine, implicating mainstream media, big tech, and intelligence communities in alliances with big pharma and public health agencies. During the COVID-19 pandemic, Dr. Fauci played a central role, with the United States initially seen as a leader in public health. However, Robert F. Kennedy Jr. argues that Dr. Fauci's policies led to a high number of deaths in the U.S. compared to other nations. The data provided shows that the U.S. had a significantly higher COVID-19 mortality rate per million population compared to countries like Japan, South Korea, and China. Robert F. Kennedy Jr. criticizes Dr. Fauci's focus on mass vaccination, alleging that he overlooked the broader costs of his policy directives, such as the economic impact and the effects of lockdowns on mental health and poverty. The story cites data indicating a decrease in life expectancy in the U.S. during the quarantine period, as well as the negative effects of lockdowns on global poverty and child welfare. The author accuses Dr. Fauci of overseeing the demolition of America's economy during the COVID-19 pandemic, resulting in job losses and bankruptcies. He also points to a massive transfer of wealth to billionaires and tech companies during this period. Robert F. Kennedy Jr. claims that internet companies suppressed criticism of the government and pharmaceutical products, contributing to a censorship and surveillance state. Robert F. Kennedy Jr. argues that Dr. Fauci's leadership at NIAID has coincided with a decline in public health, including a rise in chronic diseases among children. He questions why conditions like allergies and autoimmune diseases have become more prevalent since Dr. Fauci took office. The author suggests that environmental toxins and vaccines may be contributing factors, but alleges that Dr. Fauci has not prioritized research into these issues. Robert F. Kennedy Jr. criticizes Dr. Fauci for prioritizing pharmaceutical industry profits over public health, accusing him of falsifying science, deceiving the public, and lying about safety and efficacy. He mentions experiments on Black and Hispanic children, as well as the role of Dr. Fauci and Bill Gates in conducting clinical trials of experimental drugs in Africa. The story questions Dr. Fauci's involvement in gain-of-function experiments and his promotion of false pandemics for pharmaceutical profits. Chapter 1. Dr. Fauci's strategy for managing the COVID-19 pandemic involved mandatory measures like masking and lockdowns, while instructing COVID patients to return home without treatment until breathing difficulties sent them to the hospital for remdesivir and ventilation. Robert F. Kennedy Jr. argues that this approach lacked scientific support and led to high body counts in America. According to Robert F. Kennedy Jr., medicines were available that could have prevented hospitalizations and saved lives, but Dr. Fauci and his collaborators suppressed them to promote novel vaccines. He claims that masking, quarantines, and social distancing lacked scientific backing and caused more harm than they averted. Robert F. Kennedy Jr. points out that Dr. Fauci was aware that his mask decrees were contrary to science. He cites emails and speeches where Dr. Fauci acknowledged the ineffectiveness of ordinary masks against viral infection. Robert F. Kennedy Jr. also notes that peer-reviewed studies have not supported masking the healthy, and that some studies attribute harms to masking, including respiratory and psychological injuries. Social distancing mandates also lacked a scientific basis, according to Robert F. Kennedy Jr. He quotes former FDA Commissioner Dr. Scott Gottlieb, admitting that the 6-foot distancing rule was arbitrary. Additionally, the author notes that lockdowns were unprecedented and that WHO officials recommended against them, citing the potential for increased poverty and malnutrition. Robert F. Kennedy Jr. claims that Dr. Fauci manipulated data to serve the vaccine agenda. He points to inaccurate modeling, selective protocol changes for death certificates, and misuse of PCR tests. He also criticizes Dr. Fauci's refusal to fix the vaccine injury surveillance system and the lack of transparency in data related to COVID-19. Robert F. Kennedy Jr. accuses Dr. Fauci of suppressing early treatment options and ignoring natural immune response. He notes that Dr. Fauci did not advise Americans on how to bolster their immune systems through measures like avoiding tobacco, getting sunlight, and maintaining adequate vitamin D levels. Robert F. Kennedy Jr. highlights the views of experts like epidemiologist Harvey Risch and cardiologist Peter McCullough, who argue that early treatment protocols and repurposed drugs could have reduced fatalities and hospitalizations. He claims that Dr. Fauci's focus on vaccines and remdesivir led him to ignore or suppress effective early treatments. According to Robert F. Kennedy Jr., hydroxychloroquine, HCQ, posed a threat to Dr. Fauci and Bill Gates' vaccine project because it could have prevented the emergency use authorization of new vaccines. He notes that HCQ had a long history of safe medical use, and that some studies deemed it effective against coronaviruses, especially when taken early with zinc and zithromax. Robert F. Kennedy Jr. claims that pharmaceutical interests launched a multinational campaign to restrict and discredit HCQ. He points to the removal of HCQ from pharmacy shelves in some countries and the suppression of information, demonstrating its efficacy on social media platforms. Robert F. Kennedy Jr. accuses Dr. Fauci, Bill Gates, and WHO of financing fraudulent studies to discredit HCQ. He claims that these studies used overdose concentrations of chloroquine and failed to incorporate important components of HCQ protocols. Robert F. Kennedy Jr. discusses the LancetGate scandal, in which 2 prestigious medical journals published fraudulent studies from a non-existent database to discredit HCQ. He notes that the studies were later retracted due to widespread criticism. According to Robert F. Kennedy Jr., ivermectin, IVM, is another COVID remedy that has shown life-saving efficacy. He notes that IVM has been used for decades as an antiparasitic, and that some studies have demonstrated its antiviral effects. Robert F. Kennedy Jr. also claims that IVM has shown greater efficacy against COVID than vaccines in prophylaxis studies. Corey testified that ivermectin could significantly reduce hospitalizations and deaths, potentially saving the country $1 trillion. Many frontline physicians believed early treatment with ivermectin could have prevented a large percentage of deaths and hospitalizations. However, the NIH's stance on ivermectin was neutral, neither recommending for nor against its use, despite evidence of its safety and efficacy. Robert F. Kennedy Jr. notes that the NIH shrouded its decision-making process in secrecy, refusing to disclose the panel members involved in the ivermectin deliberations. Some members of the NIH Guidelines Committee had financial ties to Merck. a company with a competing drug. While the US moved to eliminate ivermectin use, other countries like India and Indonesia saw dramatic declines in COVID deaths after adopting it. A study showed that African and Asian countries with widespread ivermectin use had some of the world's lowest COVID case and mortality rates. Dr. Teslori's meta-analysis found ivermectin reduced deaths by 62% and COVID infections by 86%. However, WHO researcher Andrew Hill, after initially supporting ivermectin, reversed his position, citing low-quality evidence, allegedly due to pressure from his sponsors, including Unitaid, which is funded by the Bill and Melinda Gates Foundation. Robert F. Kennedy, Jr. writes that the FDA issued warnings against ivermectin, and government agencies moved to block its use. Social media platforms censored information about ivermectin's benefits. Merck, the original manufacturer of ivermectin, suddenly discovered safety concerns after its patent expired, and it had developed a competing drug, molnupiravir. Molnupiravir, developed with funding from the Defense Threat Reduction Agency, DTRA and NIAID, has a similar mechanism of action to ivermectin, but costs significantly more. Robert F. Kennedy Jr. notes that as Merck prepared to release molnupiravir, the medical media cartel launched a campaign to brand ivermectin as a dangerous horse drug. The FDA, CDC, and NIH warned against its use, and media outlets promoted the idea that people were poisoning themselves with a horse deworming drug. In contrast, remdesivir, a drug developed by Gilead with funding from NIAID and in which the Bill and Melinda Gates Foundation has a stake, received an emergency use authorization despite concerns about its toxicity and limited efficacy. Robert F. Kennedy Jr. explains that Dr. Fauci and Bill Gates predicted that a vaccine would stop COVID transmission and end the pandemic. However, coronavirus vaccines face challenges, including rapid mutation and the risk of pathogenic priming. Dr. Fauci's strategy involved developing an mRNA platform for vaccines that would allow for quick production of new boosters to combat escape variants. Dr. Fauci employed several tactics to hide evidence of ADE, including aborting clinical trials early, failing to fix the vaccine injury surveillance system, enlisting media companies to censor reports of injuries, discouraging autopsies, and populating key committees with loyalists. Robert F. Kennedy Jr. discusses concerns about Dr. Fauci's handling of the COVID-19 pandemic, focusing on vaccine strategies and potential conflicts of interest. One major point is the idea that Dr. Fauci, by pushing for vaccination of the entire population, might be trying to eliminate a control group, which would make it harder to track and understand vaccine injuries. Robert F. Kennedy, Jr. mentions that Dr. Fauci initially seemed against mandatory vaccinations, but later supported coercive measures to get more people vaccinated. Robert F. Kennedy, Jr. raises questions about the effectiveness and safety of the Pfizer vaccine. He points out that during Pfizer's clinical trials, more people in the vaccine group died compared to the placebo group. Robert F. Kennedy, Jr. argues that the vaccine's benefits were exaggerated by using relative risk instead of absolute risk to present the data. For example, he explains that while Pfizer claimed 100% efficacy against death, because only one person died in the vaccine group versus 2 in the placebo group, the actual data shows that 22,000 vaccines had to be given to save a single life from COVID. Robert F. Kennedy Jr. also highlights international data suggesting that countries with high vaccination rates experienced spikes in COVID infections, raising concerns about pathogenic priming, where vaccines might make people more susceptible to the virus. He cites examples like Gibraltar, Malta, and Iceland, where infections surged after aggressive vaccination campaigns. Robert F. Kennedy, Jr. points to data from VAERS showing a significant increase in reported deaths and injuries following COVID vaccines compared to all other vaccines over the past 3 decades. He also mentions studies suggesting that COVID vaccines may be causing more deaths than they are preventing. Robert F. Kennedy Jr. accuses the CDC of manipulating data to hide vaccine-related deaths, such as counting people as unvaccinated if they die within 2 weeks of their second dose. He also criticizes the media for censoring reports of vaccine deaths and injuries. Robert F. Kennedy, Jr. argues that vaccinating children is unethical, given their low risk from COVID and the potential for vaccine injuries. He cites data suggesting that teen deaths in the UK increased after the vaccine rollout. Robert F. Kennedy, Jr. touches on the issue of waning vaccine efficacy, citing studies showing that the protection offered by COVID vaccines drops significantly after a few months. He also notes that vaccinated individuals are equally likely to spread COVID, undermining the rationale for vaccine mandates. Robert F. Kennedy, Jr. also brings up the role of Bill Gates, noting that the Bill and Melinda Gates Foundation has provided significant funding to institutions like Imperial College London and Johns Hopkins University, which have been involved in COVID-19 research and vaccine promotion. He suggests this funding creates potential conflicts of interest. Robert F. Kennedy, Jr. also discusses how Gates was involved in promoting certain narratives around COVID-19 and vaccines. Robert F. Kennedy, Jr. highlights several critical points regarding Anthony Fauci and Bill Gates' roles during the COVID-19 pandemic. One major area of concern is the suppression of early treatments like hydroxychloroquine and ivermectin in favor of promoting vaccines and expensive drugs like remdesivir. Robert F. Kennedy, Jr. points out that despite numerous studies suggesting the potential benefits of ivermectin in preventing and treating COVID-19, Fauci and other health authorities dismissed it, sometimes using misleading information. For example, the FDA and media outlets warned against using ivermectin, implying it was only a horse dewormer, while the CDC uses it to treat refugees and migrants. This created public confusion and limited access to a potentially helpful, low-cost treatment. Similarly, hydroxychloroquine, an inexpensive and widely available drug, was also sidelined. Robert F. Kennedy, Jr. notes that Fauci publicly stated that no placebo-controlled trial had shown hydroxychloroquine to be effective, despite some studies suggesting otherwise. This stance influenced treatment guidelines and public perception, steering focus away from early treatment options. Instead, there was a strong push for remdesivir, a patented drug developed by Gilead Sciences. Robert F. Kennedy, Jr. emphasizes that remdesivir had a high price tag, over $3,100 for a course of treatment, and a questionable track record, with some studies showing limited or no impact on survival. The WHO, for instance, recommended against its use, yet it became a primary treatment in many hospitals. Robert F. Kennedy, Jr. also raises concerns about the financial ties between key players and the pharmaceutical industry. He notes that the Bill and Melinda Gates Foundation has significant investments in Gilead Sciences, the maker of remdesivir, and that Fauci's NIAID, National Institute of Allergy and Infectious Diseases, funded research at UNC Chapel Hill that contributed to remdesivir's development. These financial connections, according to Robert F. Kennedy, Jr., create potential conflicts of interest that may have influenced treatment decisions. The emphasis on vaccines as the primary solution is another point of contention. Robert F. Kennedy, Jr. argues that while vaccines can play a role, they were promoted as the only way out of the pandemic, overshadowing other potential treatments and preventive measures. Concerns about vaccine safety and efficacy were often dismissed or censored. Robert F. Kennedy, Jr. cites instances where data on adverse events reported to VAERS, Vaccine Adverse Event Reporting System, were downplayed, and scientists who raised concerns about vaccine safety were silenced. Robert F. Kennedy, Jr. also touches on the concept of natural immunity, suggesting that individuals who have recovered from COVID-19 may have robust and long-lasting immunity, potentially negating the need for vaccination. He points to studies indicating that natural immunity may be as effective, if not more effective, than vaccine-induced immunity. Despite this, vaccine mandates were implemented, often without regard for individuals' prior infection status. Robert F. Kennedy, Jr. suggests that the focus on vaccines and expensive drugs, coupled with the suppression of early treatments and the downplaying of safety concerns, may have been driven by financial incentives and conflicts of interest, rather than purely scientific considerations. Chapter 2. For 5 decades, Dr. Anthony Fauci has significantly influenced the pharmaceutical industry's growth and its impact on government regulatory agencies and public health policy. Throughout his career, Dr. Fauci has cultivated a network of financial connections between pharmaceutical companies and the National Institute of Allergy and Infectious Diseases, NIAID, effectively turning NIAID into a subsidiary of the pharmaceutical industry. He openly refers to this relationship with pharma as a public-private partnership. From his position at NIAID, Dr. Fauci has utilized his substantial annual budget to exert control over various agencies and organizations, including the Centers for Disease Control and Prevention, CDC, the Food and Drug Administration, FDA, Health and Human Services, HHS agencies, the National Institutes of Health, NIH, the Pentagon, the White House, the World Health Organization, WHO, the United Nations, UN, and even the Clinton and Gates Foundations, as well as the Wellcome Trust in Britain. With his considerable grant budget, Dr. Fauci has the power to shape careers, influence university research centers, manipulate scientific journals, and dictate the direction and outcomes of scientific research worldwide. Since 2005, the Defense Advanced Research Projects Agency, DARPA, has contributed billions to Dr. Fauci's discretionary budget, which is used to fund biological weapons research, often of questionable legality. Working closely with pharmaceutical companies and major funders like Bill Gates, Dr. Fauci has consistently used his authority to suppress scientists whose research challenges the pharmaceutical industry, while rewarding those who support him. Dr. Fauci's funding decisions favor the development and promotion of patented medicines and vaccines, while undermining off-patent therapeutic drugs, nutrition, vitamins, and natural medicines. During his tenure, drug companies have fueled the opioid crisis, leading to Americans being among the most over-medicated populations globally. Over his half-century as a health leader, Dr. Fauci has played a key role in creating a system where Americans pay the highest prices for medicine, but experience worse health outcomes compared to other developed nations. Adverse drug reactions are a leading cause of death in the United States. Under Dr. Fauci's leadership, NIAID has become deeply intertwined with the pharmaceutical industry, resembling a drug company more than a scientific agency. Researchers at NIAID often supplement their income by attending pharma seminars and sharing insider information about drug research. Additionally, NIAID employees frequently undertake private projects for drug companies in their NIAID labs and conduct clinical trials for pharma's new drugs. This practice is justified by NIAID officials as a way to strengthen the agency's labs and retain talented staff. However, it has also led to ethical concerns, as highlighted by a 2004 Office of Government Ethics investigation that criticized Dr. Fauci for failing to manage conflicts of interest between his staff and pharmaceutical companies. Dr. Fauci's drug development enterprise involves additional conflicts of interest. Pharmaceutical companies often pay royalties to Dr. Fauci, his employees, and NIAID itself. This system allows pharma to channel profits from drug sales back to NIAID and its officials who worked on the product. Dr. Fauci and his NIAID subordinates can personally earn significant amounts annually from drugs they helped develop using taxpayer funds. The United States Department of Health and Human Services, HHS, holds thousands of patents. A report from the United States Government Accountability Office, GAO, revealed that the NIH has received billions in royalty revenue since 1991. However, some records suggest that the NIH may not have been fully transparent with the GAO investigators, as certain patents associated with high revenue-generating compounds were missing from the report. NIAID grants have resulted in numerous patents and patent applications, with only a fraction assigned to the Department of Health and Human Services as an owner. Dr. Fauci has assigned most of these patents to universities, making the commercial beneficiaries unclear while securing the loyalty of medical schools and influential physicians. Since Dr. Fauci's arrival at NIH, the agency has spent hundreds of billions. A study showed that every drug approved by the FDA between 2010 and 2016 originated, at least in part, from NIH-funded research. Following drug approval, Dr. Fauci continues to collaborate with pharmaceutical partners on promoting, pricing, and profiting from their products. This collaboration often involves negotiating favorable terms for pharma at the expense of taxpayers and consumers. Dr. Fauci has been criticized for prioritizing high-priced patent medicines that benefit the pharmaceutical industry over public health. Critics argue that federal health officials like Dr. Fauci have transformed NIAID, NIH, CDC, and FDA into marketing arms for pharmaceutical companies. Under Dr. Fauci's leadership, the commercial aspects of this partnership have overshadowed the agency's mission to advance science. Chapter 3. Anthony Stephen Fauci was born in Brooklyn on December 4, 1940. His career began at the National Institute of Allergy and Infectious Diseases, NIAID, where he became director in 1984. Robert F. Kennedy Jr. notes that when Dr. Fauci took over NIAID, it was a relatively unimportant agency because infectious diseases were no longer a major cause of death in America, thanks to improvements in nutrition, sanitation, and hygiene. However, the emergence of HIV/AIDS provided an opportunity for Dr. Fauci to increase the agency's power and visibility. Robert F. Kennedy, Jr. explains that Dr. Fauci used public fear of pandemics to keep NIAID relevant, a strategy that involved exaggerating the severity of contagions to further his career. Critics argue that Dr. Fauci was not a particularly skilled scientist or manager, but excelled at bureaucratic infighting and self-promotion. One of Dr. Fauci's key strategies was to outsource drug research to principal investigators, PIs, who were effectively controlled by pharmaceutical companies. These PIs, according to Robert F. Kennedy Jr., are academic physicians and researchers who use federal grants and industry contracts to conduct clinical trials for new pharmaceutical products. They act as lobbyists, spokespersons, and enforcers for the pharmaceutical paradigm, influencing medical boards, censoring dissent, and guiding clinical trial outcomes. Robert F. Kennedy, Jr. points to the 2006 meeting of the CDC's Advisory Committee on Immunization Practices, ACIP, as an example of how Dr. Fauci and his pharma partners use PIs to control key FDA and CDC panels. The ACIP recommended 2 new Merck shots, the Gardasil HPV vaccine and a rotavirus vaccine. Both Bill Gates and Tony Fauci, via NIAID, had provided funding for the development of these vaccines. Despite concerns about their safety and effectiveness, the vaccines were approved, with 9 of the 13 ACIP panel members and their institutions receiving over $1.6 billion of grant money from NIH and NIAID. Robert F. Kennedy Jr. highlights Paul Offit, a prominent PI and vaccine developer, as an example of the conflicts of interest within this system. Offit co-developed the rotavirus vaccine and profited significantly from its approval, selling his patent rights to Merck for $186 million. He also serves on various pharma front groups and commands a network of bloggers and trolls who stifle debate and promote pharmaceutical agendas. Robert F. Kennedy Jr. argues that such PIs control public marketing and promote the pharmaceutical paradigm, often at the expense of public health. Robert F. Kennedy Jr. concludes that Dr. Fauci's decision to transfer NIAID's budget to pharmaceutical PIs was an abdication of the agency's duty to address the rising epidemics of allergic and autoimmune diseases. Instead, NIAID money became a subsidy to the pharmaceutical industry, creating a pipeline of profitable new drugs to treat the symptoms of these diseases. Robert F. Kennedy Jr. argues that this system is hostile to non-pharmaceutical remedies and perpetuates a cycle of dependency on pharmaceutical products. Chapter 4. The AZT approval process served as a trial run for Tony Fauci, during which he developed and refined a range of corrupt, deceitful, and bullying practices that he would replicate over the next 33 years to transform NIAID into a drug development powerhouse, according to Robert F. Kennedy Jr. When Dr. Fauci entered the principal investigator, PI drug testing arena, only one pharmaceutical company, Burroughs Wellcome, had a drug candidate ready to test as an AIDS remedy, a toxic compound known as AZT. AZT, initially developed as a leukemia chemotherapy, was found to be ineffective against cancer and extremely lethal in mice. However, after NIH identified HIV as the probable cause of AIDS in 1983, Samuel Broder, head of the National Cancer Institute, NCI, launched a project to screen antiviral agents. In 1985, his team discovered that AZT killed HIV in test tubes. This inspired Burroughs Wellcome to retrieve AZT and patent it as an AIDS remedy, setting the price at up to $10,000 per patient per year, making it one of the most expensive drugs in pharmaceutical history. When Fauci took over the HIV program from NCI, NIAID inherited AZT. Burroughs Wellcome's PIs came to dominate NIAID's clinical trial system, forming a web-linking Wellcome, the drug AZT, and the NIH. They came to sit on the Institute's key drug selection committee, and they voted on whether to give high or low priority to the testing of each anti-AIDS drug, including those that might possibly compete with AZT in the marketplace. Dr. Fauci would later mimic this successful model to populate key drug and vaccine approval committees in FDA, CDC, and at the Institute of Medicine, IOM, with his pharma pies. Despite promising results with off-label therapeutic drugs by community-based AIDS doctors, Dr. Fauci refused to test any of those repurposed drugs, which had older or expired patents and no pharma patrons. Because of Dr. Fauci's inexperience and perhaps deliberate sandbagging, he and his pies had only managed to fill 5–10% of the slots in his clinical trials for other promising drugs that would compete with AZT. At the mercy of Burroughs Wellcome, Dr. Fauci cut the company pies every courtesy to accelerate AZT's approval. FDA and NIH waived long-term primate studies that would be a high-risk gambit on a compound of such well-known toxicity. AIDS activists and public health officials wondered where all the grant money went, complaining that Dr. Fauci was not being forthcoming about the status and enrollment of his clinical trials, stonewalling inquiries and veiling the entire process in secrecy. It was a hardwired reflex at NIAID to exaggerate public fears of pandemics, and Dr. Fauci's first instinct as national AIDS czar had been to stoke contagion terror. Finally, AIDS activists further complained that Dr. Fauci lacked sensitivity and human compassion toward people suffering from the disease. Melissa Wallach, who researched Dr. Fauci intensively for her film, said that Dr. Fauci was a liar, utterly beholden to pharmaceutical companies, and hostile to any product that would compete with AZT, costing a lot of people their lives. In the spring of 1988, Dr. Fauci's congressional sponsors turned on him during a dramatic Capitol Hill confrontation. California Congresswoman Nancy Pelosi complained of Dr. Fauci's lackluster performance that, from our perspective, we have a burning building behind us, and we're coming to you all for water, and we're finding out that there's not somebody there to turn on the faucet. After the congressional hearing, everyone realized that the little emperor had no clothes. Dr. Fauci recognized that his political life was dangling by a thread. He had spent hundreds of millions of dollars building a drug testing network that didn't work. Dr. Fauci needed a makeover, and this master of bureaucratic survival responded to his existential crisis with a breathtaking pivot. Suddenly, Dr. Fauci turned to embrace the AIDS activists he had previously reviled. Whether Dr. Fauci's brief conversion was ever heartfelt, it was necessarily short-lived. AIDS activists afterward learned that at the same time Dr. Fauci was telling them, and Senator Kennedy's office that he was finally testing Al-721. Teflon Tony was confiding to his pharmapies that he had rigged the Al-721 studies to fail. In July 1987, the New England Journal of Medicine, NEJM, finally published Burroughs Wellcome's official report on the Phase II AZT trials, the so-called Fischel study, which was the basis of the FDA's approval of AZT. 18 months after AZT's approval, FDA conducted its own investigation of the study, revealing that the Fauci/Burroughs Wellcome research teams had engaged in widespread data tampering. AZT is the most toxic drug ever approved for long-term use. Throughout the 1980s, the average lifespan of a patient on AZT was 4 years. Many credible scientists argued that AZT was killing more people than AIDS. Lauritsen estimated that AZT killed 330,000 gay men between 1987 and 2019, many of whom were perfectly healthy before beginning the AIDS regimen. A key and enduring legacy of the AZT battle was Dr. Fauci's emergence as the alpha wolf of HHS. His enormous budget and multiplying contacts on Capitol Hill, the White House, and the medical industry thereafter allowed him to influence or ignore a succession of politically appointed HHS directors, and to bully, manipulate, and dominate HHS's other sister agencies, most notably FDA. During his battle to win FDA approval for AZT, Dr. Fauci pioneered the strategies upon which he would build his career and then showcase for the world during the COVID epidemic. By repeatedly using these formulas for 50 years, Fauci directed his agency away from its core responsibility and transformed his agency into a profit-making appendage for itself and for Big Pharma. Chapter 5. Robert F. Kennedy Jr. hesitated to include this chapter because any questioning of the orthodoxy that HIV is the sole cause of AIDS remains an unforgivable, even dangerous, heresy among our reigning medical cartel and its media allies. But one cannot write a complete story about Tony Fauci without touching on the abiding and fascinating scientific controversy over what he characterizes as his greatest accomplishment and his life's work. From the outset, Robert F. Kennedy Jr. wants to make clear that he takes no position on the relationship between HIV and AIDS. He includes this history because it provides an important case study illustrating how, some 400 years after Galileo, politics and power continue to dictate scientific consensus, rather than empiricism, critical thinking, or the established steps of the scientific method. It is a hazard to both democracy and public health when a kind of religious faith in authoritative pronouncements supplants disciplined observation, rigorous proofs, and reproducible results as the source of truth in the medical field. While consensus may be an admirable political objective, it is the enemy of science and truth. The term settled science is an oxymoron. The admonishment that we should trust the experts is a trope of authoritarianism. Science is disruptive, irreverent, dynamic, rebellious, and democratic. Consensus and appeals to authority, be it CDC, WHO, Bill Gates, Anthony Fauci, or the Vatican, are features of religion, not science. Science is tumult. Empirical truth generally arises from the tilled, agitated, and upturned soils of debate. Doubt, skepticism, questioning, and dissent are its fertilizers. Every great scientific advance in history, every transformative idea, from evolution to heliocentrism to relativity, met initial ridicule from the panjandrums of scientific consensus. Specifically, the original hypothesis on AIDS is an illustration of how vested interests, in this case, Dr. Anthony Fauci, using money, power, position, and influence, can engineer consensus on incomplete theories and then ruthlessly suppress dissent. Instead of responding to critics by answering common-sense inquiries, Dr. Fauci has cultivated a theology that denounces questioning of his orthodoxy as irresponsible, uninformed, and dangerous heresy. It's axiomatic that American democracy thrives on the free flow of information and abhors censorship. So Dr. Fauci's extraordinary capacity to ruthlessly silence, censor, ridicule, defund, and ruin prominent dissidents seems more congruent with the Spanish Inquisition or with Soviet and other totalitarian systems. Finally, many of the tactics Dr. Fauci has pioneered to dodge debate, bedazzling and bamboozling the press into ignoring legitimate inquiry of the credo, and undermining, gaslighting, punishing, bullying, intimidating, marginalizing, vilifying, and muzzling critics, have become his mainstays for derailing skepticism about his mismanagement of subsequent pandemics, including COVID. So without attempting to draw conclusions about the underlying HIV/AIDS disputes, it is worth reviewing the weapons Dr. Fauci honed during his natal struggle to construct and fortify a scientific theology. Robert F. Kennedy Jr. restates that he takes no side in this dispute. It seems undeniable to him that the dissidents have raised legitimate queries that should be researched, debated, and explored. Robert F. Kennedy Jr. believes public health officials have a duty to answer these sorts of questions, and he yearns to hear those arguments in an energized debate. Dr. Fauci's aggressive censorship campaign and his refusal to debate arouse Robert F. Kennedy Jr.'s suspicion and ire. If any of Dr. Duesberg's revelations are solid, his story has momentous relevance today, as the removal of his tongue illustrates the capacity of the pharmaceutical cartel, in league with self-interested technocrats, to exaggerate and exploit viral pandemics, to foist toxic and dangerous remedies onto a credulous public, and promote self-serving agendas, even those with terrible outcomes, with the complicity of a fawning and scientifically illiterate media. With grants from Tony Fauci, intrepid researchers quickly found that the contagion had somehow reached Africa and infected up to 25 million Africans, with no one having taken notice. Researchers, extrapolating from small cohorts with positive PCR results, used murky statistical models to report HIV had infected nearly half the adult population in some nations, and forecast widespread depopulation of the African continent. None of the shrilly predicted depopulation has ever occurred, and most HIV-infected Africans showed no sign of illness. In those who were sick, the infirmities looked very much like the illnesses that doctors had previously diagnosed as malaria, pneumonia, malnutrition, leprosy, bilharzia, anemia, tuberculosis, dysentery, or infection, with a grim inventory of pathogens and parasites familiar to doctors in Africa. It was natural that Gallo found a powerful and reliable ally in Tony Fauci. Gallo's proof that the cause of AIDS was a virus, as opposed to toxic exposures, provided the critical foundation stone of Dr. Fauci's career. This claim allowed Dr. Fauci to capture the AIDS program and its attendant cash flows from the National Cancer Institute, NCI, and launch the project of building NIAID into the world's leading drug production empire. Chapter 6. In 1991, a group of scientists, including Nobel laureates, questioned Robert Gallo's HIV hypothesis and requested an open debate. However, medical journals like Nature and the New England Journal of Medicine refused to publish their letter, allegedly due to their reliance on pharmaceutical industry funding. These journals, as noted by Lancet editor Richard Horton, have become information laundering operations for the pharmaceutical industry. Dr. Fauci's influence on these journals further solidified the prevailing orthodoxy. One prominent scientist, Dr. Peter Duesberg, challenged Gallo's findings, arguing that HIV was a harmless passenger virus. He pointed out that retroviruses, like HIV, have coexisted with humans for billions of years and are not typically cell killers. Duesberg's skepticism was met with strong resistance. Dr. Fauci and the medical establishment ostracized him, leading to the loss of his funding and professional standing. As Dr. Charles Thomas noted, the need to hold onto HIV was driven by the desire to hold on to their funding. Dr. Fauci and his allies attacked Duesberg and other dissidents as flat earthers and denialists. Duesberg's research grants were terminated, and he was effectively banished from the scientific community. The media also played a role, with AIDS organizations pressuring journalists to avoid interviewing Duesberg. Despite the opposition, Duesberg's skepticism spread among researchers. Nobel laureate Kary Mullis questioned why one new organism was suddenly blamed for numerous diseases, defying common sense. Christine Magyar added that the HIV test was not a test for AIDS, and the problems called AIDS did not elevate it into a disease. Other scientists, like Dr. Eleni Papadopoulos and Dr. Val Turner, argued that Gallo's claim was specious and that HIV had never been properly isolated. Instead of engaging in open debate, Dr. Fauci and his associates silenced dissenting voices. Duesberg's theories pointed to environmental factors, such as heavy recreational drug use, as the real cause of immune deficiency. He noted that early AIDS patients often engaged in behaviors common in the gay party scene, including promiscuous sex and the use of psychoactive drugs like amyl nitrite, poppers. Dr. Fauci himself conceded in 1984 that drugs could explain PCP, a signature symptom of AIDS. After 1987, Duesberg argued that many AIDS deaths were caused by AZT, a toxic chemotherapy drug prescribed to treat AIDS. He claimed that AZT caused immune collapse, doing what the virus could not. AZT, initially deemed too toxic for even short-term cancer therapy, was prescribed for life, leading to severe side effects and, according to Duesberg, more deaths. In contrast, Dr. Shaiching Lo discovered a mycoplasma in AIDS patients, suggesting it worked with HIV to cause AIDS. Luc Montagnier also found that HIV only became dangerous in the presence of a second organism, a mycoplasma, which could be stopped with tetracycline. Despite these findings, Dr. Fauci did not fund research on these cofactors. Carrie Mullies observed that the financial and career incentives for proving Dr. Fauci's proposition were so great that the inability to do so suggested HIV alone did not cause AIDS. He noted that if a postdoc could write a review showing HIV caused AIDS, they would become famous and receive lifelong funding from Dr. Fauci, but no one had done so. The presumption that HIV is the sole cause of AIDS became the cornerstone of a multi-billion-dollar industry. Charles Ortleb noted that he who dispenses the money can control the science. This financial incentive, combined with the fear of losing income and position, led to the suppression of dissenting voices and the perpetuation of the HIV/AIDS orthodoxy. Chapter 7. During his time as the head of the National Institute of Allergy and Infectious Diseases, NIAID, Dr. Anthony Fauci has been accused of treating vulnerable children as expendable in the pursuit of profitable pharmaceutical solutions. This story suggests that the path to regulatory approval for AZT in 1988 paved the way for a multi-billion-dollar boom in HIV drugs, and Dr. Fauci allegedly allowed unethical human experimentation that exposed children and adults to toxic compounds. Government regulators and pharmaceutical companies have been accused of combining racial discrimination with child abuse in drug and vaccine development campaigns. During polio vaccine experiments in the 1950s and 1960s, U.S. vaccinologists allegedly recruited Black African children for mass trials with experimental vaccines. In 1989, the CDC reportedly conducted lethal experiments with a hazardous measles vaccine on Black children in Cameroon, Haiti, and South Central Los Angeles. In 1989, Dr. Fauci declined an offer to become NIH director, stating that his involvement with the AIDS epidemic was his passion and life's work. However, his power as NIAID director surpassed that of the NIH director, granting him global influence over scientific research and international health policy. The NIAID directorship also provided publicity opportunities and partnerships with pharmaceutical companies. Dr. Fauci's collaboration with pharmaceutical companies in the approval of AZT in 1987 strengthened his relationship with pharma and lowered NIAID's standards for product approvals. The 1980 Bayh-Dole Act allowed NIAID and Dr. Fauci to file patents on new drugs and collect royalties on their sales, blurring the lines between public health and pharma profits. Financial conflicts with pharmaceutical companies became a defining feature of Dr. Fauci's governance. In 1992, a Department of Health and Human Services Inspector General investigation concluded that NIAID failed to police conflicts of interest by his PIs in a vaccine clinical trial. In 2004, journalist Liam Sheff chronicled Dr. Fauci's experiments on HIV-positive foster children at Incarnation Children's Center, ICC, in New York City and other facilities. These experiments aim to develop a second generation of profitable AIDS drugs. Black and Hispanic foster children were allegedly turned into lab rats, subjected to unsupervised drug and vaccine studies. NIAID's pharma partners remunerated ICC for supplying children for the tests, and Dr. Fauci allegedly rigged the Safety Oversight Board with loyal PIs. The drugs given to the children were reportedly toxic, causing genetic mutation, organ failure, and brain damage. Children who refused the drugs were force-fed, and some had tubes surgically implanted in their stomachs. At least 10 children died during one trial involving the drug dapsone, and researchers were unable to determine a safe dosage. Vera Sharav accused NIAID and its partners of disposing of children's remains in mass graves. A BBC documentary, Guinea Pig Kids, chronicled the experiences of the affected children. Investigative reporter Celia Farber found a mass grave at Gate of Heaven Cemetery in Hawthorne, New York, with dozens of plain wooden coffins. She learned the story of a father who was told his son had died at ICC of AIDS and that medical records had been lost in a fire. In May 2005, an AP investigation revealed that at least 465 NYC foster children were subjects in NIAID's trials, and that Dr. Fauci's agency provided fewer than one-third of those children with an advocate. A 2004 FDA investigation urged the head of NIH to insist on better management from NIAID, and a May 2005 congressional hearing concluded that NIAID's experiments had violated federal statutes. NIAID and its partner, New York City's Administration for Children's Services, ACS, claimed they were providing cutting-edge treatments to HIV-infected children who could not afford expensive medicines. However, AHRP's investigation revealed that many of the children subjected to Dr. Fauci's experiments were perfectly healthy and may not have been HIV-infected. On March 8, 2004, NIH rejected a Freedom of Information Act, FOIA, request for adverse event reports from NIAID's trials conducted at ICC. AHRP filed a complaint with the FDA and the Office of Human Research Protections, OHRP, charging that NIAID was depriving foster children of legally mandated federal protections against research risks. AP identified at least 48 AIDS experiments NIAID conducted on foster children in 7 states, mostly in violation of the federal requirement that NIAID provide those children an advocate. In addition to the dapsone trial that killed at least 10 children, NIAID sponsored another study testing a combination of adult antiretroviral drugs. From the outset, Dr. Fauci's experiments served his obsession to develop an HIV vaccine. Medical records proved that Dr. Fauci's PIs were testing his dangerous vaccines on children from 1 month to 18 years old. NIAID was knowingly allowing its pharma partners to violate NIAID's written study protocols by conducting these experiments on children with and without proof of HIV infection. When children declined to take the toxic drugs, NIAID and its pharma partners arranged to surgically implant feeding tubes in their bellies to force obedience. Between 1985 and 2005, NIAID and its pharma partners conscripted at least 532 infants and children from foster care in New York City as human subjects of clinical trials testing NIAID's experimental AIDS drugs and vaccines. Subsequent investigations confirmed that most children did not have the protection of an independent advocate, and that they were predominantly African American and Latino, suggesting discriminatory policies. The Vera Institute confirmed 80 deaths, and that many other children suffered serious harm. In 2006, the OHRP launched its own investigation of the problems at NIAID, confirming that drug companies their PIs, and government officers failed to obtain proper consent from an independent advocate and failed to ensure safeguards for the foster children. In 2005, the NYC Administration of Child Services, ACS, commissioned a 4-year investigation by the Vera Institute, which found that 80 of the 532 children who participated in clinical trials or observational studies died while in foster care. Even after this scandal exploded, there was no evidence that Dr. Fauci made any effort to reform NIAID. In January 2008, 2 biomedical ethicists inside the NIH concluded that the agency still did not have adequate protections for vulnerable foster children. During the decades since Dr. Fauci took over NIAID, he has sanctioned drug companies to experiment on at least 14,000 children, many of them Black and Hispanic orphans living in foster homes. He permitted these companies to operate without oversight or accountability, leading to systematic abuse and, occasionally, death. In 2020, Dr. Fauci approved a $424,000 NIAID grant for experiments in which dogs were bitten to death by flies. That same year, Dr. Fauci's agency gave $400,000 to University of Pittsburgh scientists to graft the scalps of aborted fetuses onto living mice and rats. Chapter 8. As Vera Sharav notes, racism is a constant in medical authoritarianism and human experimentation. Harvey Bialy, editor of Nature Biotechnology, observed that racial and sexual bigotry and bullying are the distinguishing attributes of AIDS research. Charles Ortleb, Dr. Fauci's critic, recalls that the theme of unwanted minorities spreading contagion was a standardized soliloquy of totalitarianism. Dr. Fauci did not restrict his unethical experiments with AIDS drugs to American children. By June 2003, NIH and NIAID were running 10,906 clinical trials in 90 countries, testing new toxic antiviral concoctions. Dr. Fauci's PIs targeted developing nations that lacked strong institutional structures for protecting impoverished citizens from the abusive practices of powerful pharmaceutical multinationals. Vera Sharav says that Dr. Fauci had NIAID and its pharmaceutical company partners move his most controversial and risky studies offshore, because they can do stuff that they could never get away with in the United States. Celia Farber agrees with Sharav's assessment, stating that racism is cloaked inside carefully crafted philanthropic manipulations, such as access to drugs. Africa has been a pharma colony for over a century and is the venue of choice for companies seeking cooperative government officials, compliant populations, the lowest per-patient enrollment costs, and lacks oversight by media and regulatory officials. In 2005, FDA officials learned that Dr. Fauci's DAIDS team had concealed scores of deaths and hundreds of injuries during HIV drug trials in Africa with nevirapine. In January 2002, President Bush announced a $15 billion package to combat AIDS, including a $500 million program to purchase millions of doses of nevirapine for distribution to African mothers and children. Dr. Fauci told the president that nevirapine would save millions of lives by preventing maternal transmission of HIV to unborn children. Canadian regulators rejected nevirapine due to its potent toxicity and dubious efficacy. In December 2000, the Journal of the American Medical Association advised healthcare workers exposed to HIV to avoid prescribing nevirapine after the drug caused life-threatening liver toxicity in patients. Nevertheless, the German chemical company found a soft landing for its product at NIAID. Celia Farber says that Dr. Fauci apparently neglected to tell President Bush that nevirapine had never won FDA approval as a safe and effective drug, and that Dr. Fauci seemed confident that he eventually could get FDA to give him anything he wanted. In 1997, Uganda granted Dr. Fauci's Johns Hopkins based PI, Brooks Jackson, permission to run clinical trials on nevirapine in Kampala. In 1999, Jackson and his team reported in the medical journal Lancet. Nevirapine lowered the risk of HIV-1 transmission during the first 14-16 weeks of life by nearly 50% in a breastfeeding population. This simple and inexpensive regimen could decrease mother-to-child HIV-1 transmission in less developed countries. But the study's sunny conclusions concealed glaring methodological deficiencies, as DAIDS's official nevirapine clinical trial protocols required an inert placebo group. But once in Uganda, DAIDS's cowboy research team simply made the placebo group vanish. Instead of using a placebo, Jackson and his team ended up comparing the health outcomes in 626 pregnant women, half of whom took Dr. Fauci's horrendously dangerous chemotherapy concoction, AZT, while the other half took nevirapine. Based on this study, Dr. Fauci was able to persuade the WHO in 2000 to grant emergency use authorization approval, EUA, to single-dose nevirapine for preventing mother-to-child transmission of HIV as its official recommendation. Who was already a sock puppet for Big Pharma, and Dr. Fauci used the stopgap WHO approval to persuade President Bush to purchase millions of dollars of nevirapine. The gimmick of equalizing the carnage in both AZT and nevirapine study groups allowed the NIAID researchers to cobble together the sunny assessment of both drugs, which they published in The Lancet in summer of 1999. Only the fine print of the Lancet study revealed that 38 babies had died, 16 in the nevirapine group and 22 in the AZT group. In January 2002, Boehringer dispatched an audit team to Kampala, and in exchange for FDA agreeing to delay its visit, Boehringer promised to share its inspection report with the U.S. licensing agency. That report did little to assuage FDA's alarm, as Boehringer's own investigators described grisly mayhem in Kampala. In February 2002, NIAID hired a private consultant group, Westat, to conduct an investigation and audit of the Kampala site. The Westat audit confirmed the long inventory of severe violations of good clinical practice, including the convenient loss of critical records. The missing records included a vital logbook that appeared to have documented the study's worst atrocities before its mysterious disappearance. When Westat confronted Dr. Jackson's researchers with study discrepancies, they admitted that they routinely applied more lenient standards for their Black Ugandan subjects than FDA rules required for U.S. safety studies. The PIs admitted to systematically downgrading standardized definitions of serious adverse events to adapt to local standards. Finally, the Westat auditors refused to sign off on nevirapine because they could find no valid data suggesting that this highly toxic drug prevented HIV transmission. In March 2002, Boehringer and Gelheim consequently pulled its supplemental FDA application for nevirapine's approval, and the Johns Hopkins/NIAID team closed the scandal-ridden Uganda study site. Like AZT, nevirapine was therefore too big to fail, and such desperate circumstances summoned Teflon Tony to perform his greatest magic act: resurrect the dead. NIAID sprang into cover-up mode, and Dr. Fauci had his PR team begin the resurrection project by refashioning the Uganda charnel house scandal as a simple misunderstanding based on minor clerical errors. In July 2002, DAIDS announced that it would reassess the Uganda nevirapine study with its own in-house remonitoring protocol, a fancy construction for whitewash, managed by Fauci's top aides henchman, DAIDS Director Edmund Tramont. In an uncharacteristic faux pas, Tramont included his hand-picked DAIDS in-house review team, which included the agency's medical officer, Dr. Betsy Smith, who was not down for the cover-up. On January 29, 2003, the new president took the podium at his State of the Union speech and announced Dr. Fauci's new program to the world, the President's Emergency Plan for AIDS Relief, PEPFAR. To save the reputation of his boss and employer, and by extension everyone else implicated in this scandal, Ed Tramont rose to the task. Tramont went to work by eliminating inconvenient facts recorded by Betsy Smith and top regulatory compliance officer in the NIH's AIDS division, Mary Ann Luzar, by reorganizing the disqualified Uganda data. Tramont dismissed concerns raised by Luzar about pediatric liver problems and forged in his own bleached conclusions that the drug was safe. In Dr. Fishbein's words, Tramont simply rewrote the safety section, minimizing concerns about the toxicities, deaths, and record-keeping problems that had been highlighted by his medical safety expert. On July 11, 2003, President Bush toured the clinical trial site in Kampala, which DAIDS had hurriedly reopened and populated with temporary health workers for the occasion. In March 2005, Dr. Valandar Turner pointed out that none of the available data for nevirapine comes from a trial in which it was tested against a placebo. He observed that the transmission rate that HIV-NET12 reported for HIV, 1%, was above the background transmission rate. Farber argues that, under Dr. Fauci's leadership, the failure of researchers to properly control with a placebo group is perhaps the outstanding characteristic of AIDS research in general. Finally, during all of Dr. Fauci's tenure at NIH, Dr. Zeke Emanuel was director of the Department of Bioethics, DOB, the Ethical Oversight Board for all of NIH. Emanuel's deputy was Tony Fauci's wife, Christine Grady. In 2012, Grady took over as director of DOB. Chapter 9. In 1984, Dr. Anthony Fauci promised an AIDS vaccine, but decades and $500 billion later, none have materialized. Senator Tom Coburn accused Dr. Fauci of deceiving lawmakers to sustain his bureaucracy, suggesting failed HIV vaccine experiments serve as an ATM for the NIH, benefiting pharma partners and NIAID's funding. Despite criticisms, Dr. Fauci announced a working HIV vaccine in 2019 with minimal efficacy, showcasing his media manipulation skills. The lack of journalistic scrutiny has shrouded the quest for an AIDS vaccine in secrecy, marked by calamities, institutional arrogance, and broken promises. In 1991, Bob Gallo admitted to stealing the HIV virus, and his experiment with an HIV vaccine killed 3 AIDS patients in Paris. The NIH scientists concealed the deaths, and Gallo audaciously claimed there were no deaths or no complications in the study. Dr. Robert Redfield, former CDC director, faced accusations of data manipulation in HIV vaccine research. Despite confessing to faulty analyses, he repeated fraudulent claims, securing millions in funding. Redfield's partnership with Gallo became lucrative, with their institute receiving substantial grants from NIH and Bill Gates. Bill Gates and Dr. Fauci formed a partnership, impacting global health and corporate imperialism. Gates's influence peddling and the Microsoft antitrust case led him to establish a charity, the Children's Vaccine Program, to reshape his public image. Drawing parallels with John D. Rockefeller's medical philanthropy, Gates coordinated his foundation's giving with the Rockefeller Organization. The Rockefeller Foundation's Flexner Report in 1910 centralized medical schooling and promoted germ theory, shaping American healthcare. The conflict between miasma theory and germ theory influences public health policy, with germ theory favoring a militarized approach and pharmaceutical solutions. Despite claims, vaccines did not solely eliminate infectious disease mortalities. Nutrition and sanitation played a crucial role. Gates and Dr. Fauci's approach to public health involves weaponized pandemics, vaccines, and a new brand of corporate imperialism. The Gates/Fauci partnership skewed NIH funding towards Gates's global vaccine programs. In 2003, concerns arose about ethical issues in long-term vaccine trials in developing countries. Dr. Fauci's agency announced another failed AIDS vaccine experiment, prompting Gates to invest more in HIV vaccine development. However, another HIV vaccine trial was canceled in 2008 after data suggested it raised the risk of contracting HIV. Despite failures, Dr. Fauci and Bob Gallo continue their AIDS vaccine efforts. The field of virology is described as Dr. Fauci's Janissary Corps, defending vaccines and suppressing dissent. In 2020, HIV vaccine trials became COVID-19 vaccine trials, with Dr. Fauci launching the COVID-19 Prevention Network. Fauci virologist Christian Anderson initially saw evidence of COVID-19 being lab-generated, but later dismissed the lab leak hypothesis after Fauci's intervention. In February 2021, NIH committed to a $200 million joint initiative with the Gates Foundation for AIDS vaccines using mRNA technology. However, another African HIV vaccine experiment failed. The white man's burden is invoked to criticize Gates's HIV vaccine program in Africa. Gates's prioritization of vaccines has diverted resources from basic nutrition and functional medical devices. Gates has strategically used his money to control international health agencies, influencing global health policy to benefit his pharma partners. His vaccine obsession has diverted who's giving away from poverty alleviation. Gates's commitment to protecting pharma's intellectual property rights has faced criticism. He opposed waiving patent rights for COVID-19 vaccines, prioritizing corporate profits over global access. In February 2021, NIH said that new HIV vaccines will specifically target Africans and African Americans. Black leaders who criticized WHO vaccination policy died suddenly, raising questions. Media outlets receiving pharma advertising dollars and Gates Foundation grants often portray Gates as a public health expert, downplaying criticisms of his medical meddling in Africa. Chapter 10. In this story, Robert F. Kennedy Jr. examines Bill Gates's assertion that his African and Asian vaccines are yielding a net public health benefit. Most medicinal products cannot get licensed without first undergoing randomized placebo-controlled trials that compare health outcomes, including all-cause mortalities, in medicated versus unmedicated cohorts. In March 2017, Robert F. Kennedy Jr. met with Dr. Fauci, Francis Collins, and a White House referee to complain that HHS was, by then, mandating 69 doses of 16 vaccines for America's children, none of which had ever been tested for safety against placebos prior to licensing. Dr. Fauci and Dr. Collins denied that this was true and insisted that those vaccines were safety tested. 10 months after the meeting with Fauci and Collins, on the courthouse steps, HHS admitted that none of the mandated childhood vaccines had been tested for safety in pre-licensing inert placebo tests. Because Gates and Dr. Fauci suffer the same allergy to funding studies that examine the effectiveness of their vaccines in improving health and reducing mortality, neither man has ever offered empirical evidence to support their pivotal claim that their vaccines have saved millions of lives. The meager published science examining this question indicates that virtually all of Gates's blockbuster African and Asian vaccines, polio, DTP, hepatitis B, malaria, meningitis, HPV, and Hib, cause far more injuries and deaths than they avert. In the colonial era, Africa provided model precincts for testing new vaccines. Today, pharma still regards Africa as the beau ideal to test immunizations, and as a lucrative receptacle for dumping expired and defective stocks. Bill Gates has played a key role in legitimizing this arrangement, while collaborating with captive or corrupt WHO officials to scam Western donor nations into footing the bill, and guaranteeing rich profits for pharmaceutical companies in which, coincidentally, he holds hefty stock positions. A wave of gruesome brain injuries and deaths followed the introduction of diphtheria, tetanus, and pertussis, DTP, vaccines in the United States and Europe in the 1970s. While Western nations pulled the DTP, WHO gave pharma free rein and cash to dump its toxic inventories in Africa, Asia, and Central America, despite strong evidence of its deadly impacts. After 2002, Gates and his surrogates, GAVI, WHO, and Global Fund, made DTP the flagship for their African vaccine program, and continued giving this neurotoxic and often lethal vaccine to some 156 million African children annually. Data shows that, following their DTP immunization at 3 months, vaccinated girls had tenfold higher mortality than unvaccinated children. The girls were dying of a wide range of diseases: pneumonia, anemia, malaria, dysentery, and for 2 decades no one noticed that the dying children were predominantly those who received the vaccine. In other words, Gates's DTP vaccine, instead of saving 10 million lives, as he claims, may have unnecessarily killed millions of African girls. Many vaccines shipped to underdeveloped countries, including the hepatitis B, Haemophilus influenzae type B, and DTP inoculations, contain bolus doses of the mercury-based preservative and adjuvant thimerosal. In 2001, the Institute of Medicine recommended thimerasol's removal from all pediatric vaccines. Bill Gates helped pharmaceutical companies unload their thimerosal inventories by dumping them in developing countries. Despite the discontinuance in Western nations, Bill Gates and WHO continue to use their power to force African children to submit to a battery of potentially dangerous mercury-laced pediatric vaccines. In 2010, the Gates Foundation funded with $300 million a phase III trial of GlaxoSmithKline's experimental malaria vaccine Mosquirix in 7 African countries. Some 151 African infants died in the trial, and 1,048 of the 5,049 babies suffered serious adverse effects in both control and study groups, including paralysis, seizure, and febrile convulsions. Even with Gates's generous grub stake, GSK's crooked clinical trial researchers could only muster a feeble claim of 30% efficacy for their infanticidal jab. According to the publication Science, Mosquirix's efficacy and durability are mediocre. 4 doses offer only 30% protection against severe malaria for no more than 4 years. The biggest concerns, however, are about the vaccine's safety. On February 20, 2010, less than 1 month after he famously committed $10 billion to the WHO, Bill Gates suggested in his Innovating to Zero TED Talk in Long Beach, California, that reducing world population growth could be done in part with new vaccines. In 2009 and 2012, the Gates Foundation funded tests of experimental HPV vaccines, developed by Gates's partners GSK and Merck, on 23,000 girls 14 years old in remote provinces of India. At least 1,200 of the girls in Gates's study, 1 in 20, suffered severe side effects, including autoimmune and fertility disorders. 7 died, about 10x the U.S. death rates for cervical cancer, which almost never kills the young. Indian government investigators found that Gates-funded researchers at PATH committed pervasive ethical violations, pressuring vulnerable village girls into the trial, bullying illiterate parents, and forging consent forms. Following his seminal meeting with Dr. Fauci in 2000, Gates launched a global polio vaccine campaign, pledging $450 million through BMGF of a $1.2 billion total, and promising to eradicate polio by decade's end. The BMGF committed more than $1 billion, pushing an oral polio vaccine, OPV, that contains a live polio virus across the global south. Indian doctors blame the Gates campaign for a devastating vaccine strain epidemic of acute flaccid myelitis, a disease formerly classified as polio, that paralyzed 491,000 children in these provinces between 2000 and 2017, in direct proportion to the number of polio vaccines that Dr. Gates's minions administered in each area. Chapter 11. In 1976, as chief of the NIAID's Clinical Physiology section of the Laboratory of Clinical Investigation, Dr. Fauci was a frontline spectator during the NIH's bogus swine flu pandemic. Pharma and NIAID told Congress, the White House, and the public that the Fort Dix swine flu was the same strain responsible for the 1918 Spanish flu pandemic, which, they warned, had killed 50 million people worldwide. They were lying. Scientists at Fort Dix, the CDC, and HHS knew that H1N1 was an ordinary pig virus posing no risk for humans. Nevertheless, NIAID conducted a hard sell campaign warning of 1 million deaths in the United States. Working with the pharmaceutical companies, NIAID, CDC, and Merck persuaded incoming President Gerald Ford to sign a bill appropriating $135 million for vaccine manufacturers to inoculate 140 million Americans against the pestilence. In the end, the actual number of pandemic swine flu casualties in 1976 was not 1 million, but 1. In 2005, Dr. Fauci revived NIAID's script from the 1976 debacle. This time the villain was an avian flu, H5N1. Like an agitated Chicken Little, Dr. Fauci had been warning the world about the imminent bird flu pandemic since 2001. In 2005, Dr. Fauci crowed that his long-awaited bird flu had finally arrived. Using data from Ferguson, he warned it would kill millions of people worldwide unless he and his pharma partners could deploy a vaccine to derail the approaching Holocaust. Political and medical establishment cheerleaders mobilized for the now-familiar drill, boosting pandemic panic. In response to Dr. Fauci's lathered forecasts, the White House unveiled a Christmas list for the Bush family's favorite medicine man, including $7.1 billion to protect Americans from his avian plague. Once again, Dr. Fauci's pandemic was a no-show. By the time it was all over, the WHO estimated that by May 16, 2006, Dr. Fauci's bird flu had killed only 100 people worldwide. In 2009, Dr. Fauci once again hyped a fraudulent epidemic. This time it was the Hong Kong swine flu. That year, in a classic bait and switch, which Dr. Fauci and the Wellcome Trust helped to mastermind, the WHO, by then under control of pharma and its emergent funder, Bill Gates, declared a swine flu pandemic. 3 years earlier, Gates had appointed GlaxoSmithKline's director, Taka Yamada, to run his foundation's global health program. Gates is one of the largest funders for the Imperial College London's Modelling Centre. There was no sign of a pandemic. Nevertheless, the agency decided, in secret meetings, to declare a global pandemic, whose declaration activated $18 billion worth of sleeper contracts that WHO and Gates's other organizations had pressured various African and European countries to sign with GlaxoSmithKline and other pharmaceutical companies. The 2009 H1N1 swine flu pandemic was another hyped global contagion fraud that never materialized. In March of 2016, Dr. Fauci again misled the public, this time into believing that the Zika virus was causing an epidemic of microcephaly among newborn babies in Brazil. Dr. Fauci's critics claimed that an experimental DPT vaccine administered to pregnant women in 2015-2016 in the slums of northeast Brazil was the likely culprit for the wave of microcephaly. They accused Dr. Fauci of pointing the finger at Zika to distract attention from the more likely culprits, and to extract billions of dollars from Congress to develop yet another chimeric vaccine. By fanning the flames of pandemic panic, Dr. Fauci, buttressed by his partner Bill Gates, requested an additional nearly $2 billion congressional appropriation to NIAID to develop a Zika vaccine. Dr. Fauci funneled $125 million to a new Cambridge, Massachusetts, startup then called Moderna Therapeutics, to develop an mRNA vaccine for Zika. Gates appeared on CNBC to tout Moderna and promote its efforts to deliver a Zika jab. By 2020, Dr. Fauci could no longer credibly blame the microcephaly epidemic on Zika, and he stopped talking about his vaccine. In June 2020, Dr. Fauci, under questioning before Congress, sheepishly explained, "It was never brought to full fruition because Zika disappeared." Over a span of 2 decades, NIAID worked with the Gates Foundation to develop a vaccine against the mosquito-borne dengue virus, the most widespread tropical disease after malaria. Only a month after Fauci's agency filed its first of 305 patent applications in November 2003 toward development of mutations useful for attenuating dengue viruses and chimeric dengue viruses, the Gates Foundation announced a $55 million grant to support the pediatric dengue vaccine initiative. In July 2014, Lance Gordon, the BMGF's director for neglected infectious diseases in its global health program, released news that the Sanofi Pasteur experimental dengue vaccine that Gates and Dr. Fauci funded was showing positive clinical results. By this time, health officials had already inoculated some 800,000 Filipino children. At least 600 had died. Chapter 12. In this story, Robert F. Kennedy Jr. discusses the roles of Anthony Fauci and Bill Gates in shaping the biosecurity agenda and their involvement in pandemic preparedness and response. Fauci's role in biodefense and gain-of-function research. According to Robert F. Kennedy Jr., Fauci, as the director of the National Institute of Allergy and Infectious Diseases, NIAID, allegedly played a significant role in biodefense, especially after the 2001 anthrax attacks. The author writes that Fauci allegedly directed NIAID's biosecurity budget towards bioweapons vaccines and experiments, including gain-of-function research, which involves altering pathogens to increase their transmissibility or virulence. The author writes that this research was conducted, in part, at the Wuhan Institute of Virology, with funding funneled through organizations like Peter Daszak's EcoHealth Alliance. Gates's funding of biosecurity simulations. Robert F. Kennedy Jr. writes that Bill Gates is portrayed as a key figure in promoting biosecurity through funding various simulations and initiatives. The author writes that the Bill and Melinda Gates Foundation allegedly directed funding to Johns Hopkins Center for Civilian Biodefense Strategies, which conducted simulations like Dark Winter. These simulations, according to the author, focused on strategies for imposing coercive quarantines, censorship, mandatory masking, lockdowns, and coercive vaccinations in response to a pandemic. Cadlec's role and connections. Robert F. Kennedy Jr. highlights the role of Robert Cadlec, a bioweapons expert and government official, in shaping the biosecurity agenda. The author writes that Cadlec allegedly promoted the development of pandemic pathogens as stealth weapons and advocated for measures like mandatory vaccinations and coercive quarantines. The author writes about Cadlec's connections to spy agencies, big pharma, and military contractors, suggesting a network of influence and potential conflicts of interest. The El-Hibri family and emergent biosolutions. According to Robert F. Kennedy Jr., the El-Hibri family and their company, Emergent Biosolutions, allegedly benefited significantly from the biosecurity agenda. The author writes that Emergent Biosolutions received substantial government contracts for anthrax vaccines and other biodefense products, allegedly due to connections with figures like Cadlec and Fauci. The author writes that the company's alleged close relationship with government officials raised concerns about conflicts of interest and the allocation of resources during public health crises. CIA involvement in biosecurity. Robert F. Kennedy Jr. discusses the CIA's alleged involvement in biosecurity, including its historical role in promoting the U.S. bioweapons program and its more recent activities in monitoring biological threats. The author suggests that the CIA's involvement in vaccine development and pandemic response raises concerns about power, control, and potential conflicts of interest. Overall, Robert F. Kennedy Jr. paints a picture of Fauci and Gates as influential figures who allegedly used their positions and resources to promote a biosecurity agenda that prioritized militarized responses, coercive measures, and the enrichment of pharmaceutical companies and military contractors. The author raises concerns about conflicts of interest, lack of transparency, and the erosion of civil liberties in the name of public health.
Hit that like button and don't forget to subscribe.